Good day, ma'am. Good day, Abdallah. Kumusta kayo? I'm Jasper Braille Villaruel Pimentel, and today I'm going to present Nola Pender's health promotion model. So first, who is Nola Pender? Nola J. Pender is a nursing tourist who developed the health promotion model in 1982. She started studying health promoting behavior in the mid 1970s and first published the health promotion model in 1982. Her health promotion model indicates preventative health measures and describes nurses' critical function in helping patients prevent illness by self-care and bold alternatives. And also, Pender has been named a living legend of the American Academy of Nursing. The early life of Pender. On August 16, 1941, Nola Pender was born in Lansing, Michigan to parents who advocated education for women. Her first encounter with the nursing profession when she was 7 years old and witnessed the care given to her hospitalized aunt by nurses. So this situation led her to the desire to care for other people, and her goal was to help people care for themselves. Education. With her parents' support, Nola Pender entered the School of Nursing at West Suburban Hospital in Oak Park, Illinois, and received her nursing diploma in 1962. In 1965, she received her master's degree in human growth and development from the same university. In 1969, she moved to Northwestern University in Evanston, Illinois to obtain a PhD in psychology and education, and years later, she finished master's level work in community health nursing at Rush University. Pender's career and appointments. In 1962, Nola Pender began working on a medical surgical unit and subsequently in a pediatric unit in Michigan Hospital. For 40 years at Michigan State University, she trained students at undergraduate and graduate levels and mentored many postdoctoral candidates. Also, Pender directed many studies of her health promotion model with adolescents and adults, making her more active in nursing research. So Pender and her research unit developed the program Girls on the Move, which studies and measures intervention results as it applies to use the model to encourage young people to perform active lifestyles. Pender was and still supports nursing organizations where she devoted her time, service, and knowledge. She became the president of the Midwest Nursing Research Society from 1985 to 1987. And aside from being the American Academy of Nursing president from 1991 to 1993, she was also a member of Research America's Board of Directors from 1991 to 1993 and a member of U.S. Preventative Services Task Force from 1998 to 2002. Also, Pender was an Associate Dean for Research at the University of Michigan School of Nursing from 1990 to 2001. And as a co-founder of the Midwest Nursing Research Society, she has served as a trustee of its foundation since 2009. Some of her awards, she was named as a Living Legend of the American Academy of Nursing in 2012 and also received the Lifetime Achievements Award from the Midwest Nursing Research Society in 2005. Some of her published books includes the 8 textbooks and 50 scholarly writings and also the Health Promotion Practice 6th edition and Physical Activity Research in Nursing. So why Pender focus on health promotion? So the first one is to prevent of chronic problems because of half of the number of deaths of the population in America is caused by disease. So she want to improve quality of life in every individual and to have some positive motivation to have a healthy lifestyle and being involved in some healthy practices. Also, to provide a foundation for nursing to help them how to encourage patients to have a healthy lifestyle. It is a long-term benefits because it is still applicable today and still benefits us to have a healthy living. And also, health preventative measures and health promoting behaviors. So now, what is health promotion model? Nola Pender's health promotion model theory was originally published in 1982 and later improved in 1996 and 2002. It has been used for nursing research, education, and practices. And applying this nursing theory and the body of knowledge that has been collected through observation and research, nurses are in the top of profession to enable people to improve their well-being with self-care and positive health behaviors. Health promotion model develops to incorporate behaviors for improving health and applies across the lifespan. And also its purpose is to help nurses discover determinants of positive health behaviors so they can consult to help promote the health behavior. And also it increased lifespan, quality of life, and reduce healthcare costs. It focuses to increase a patient's well-being and achieve ideal health, the foundation for determining motivation, and guides nurses' interventions means it is proposed to help nurses know and understand the major determinants of health behaviors as a foundation for behavioral counseling to promote well-being and healthy lifestyles. The health promotion model also notes that each person has a unique personal characteristics and experiences that affect subsequent actions. Pender's health promotion model defines health as a positive dynamic state, not merely the absence of disease. Health promotion is directed at increasing a client's level of well-being, and it describes the multidimensional nature of persons as they interact with the environment to pursue health. Also, the health promotion model was designed to be a complementary counterpart to models of health protection. It develops to incorporate behaviors for improving health and applies across the lifespan. Its purpose is to help nurses know and understand the major determinants of health behaviors as a foundation for behavioral counseling to promote well-being and healthy lifestyles. Health promotion and health protection are related to each other because health promotion defined as behavior motivated by the desire to increase well-being and actualize human health potential. And also, it is an approach to wellness, while health protection or illness prevention is described as behavior motivated desire to actively avoid illness, detect it early, or maintain functioning within illness constraints. Now, you can see the health promotion model of Pender's. So in this diagram, first of all, we're going to see about the three areas of Pender's model. So the health promotion model has major concepts which focuses on three areas: the individual characteristics and experiences, behavior-specific knowledge and effect, and the behavior outcomes. Individual characteristics and experiences means that each person has a unique personal characteristics and experience that affect subsequent action. So the two subsequent of individual characteristics and experiences are prior related behavior and personal factors. Prior related behavior is how similar behavior has been done in the past, which assess whether a person undergone such type of disease or took any health promoting behavior like exercise or dietary approaches and how well did he do it. While personal factors consist of general demographic, example are age, race, health behavior, or socioeconomic status. In behavior of specific cognitions and effect, so we are going to see the set of variables for behavior-specific knowledge and effect have important motivational significance. And this set of variables determines the health-promoting behavior of a person, and these variables can be modified through our nursing actions. The first variable of behavior-specific cognitions and effect is the perceived benefits of action, which means understanding of the benefits of the health behavior. So in this part, it is the anticipated positive outcomes that may occur from healthy behavior, and the person is assessing what are the benefits will she or he get by doing this exercise or behavior. Next is perceived barriers to actions. It is the perceived obstacle to achieving the health behavior. It is an action that is the anticipated, imagined, or real blocks and cause of understanding a given behavior. The example of these barriers are the time or climatic conditions to do an exercise. Next is perceived self-efficacy, which means persons perceive ability or confidence to be able to achieve the health behavior. It is the judgment or personal capability of a person to organize and execute a health-promoting behavior. Next is activity-related effect. It is a subjective feelings or emotions prior to and during the health behavior. It is a person's effect whether it is positive or negative. So now, we are in the interpersonal influences and situational influences. So interpersonal influences is the attitude or perceived attitude of the other people who influence the patients towards the health behavior. So it may be for family or peers or care providers norms, support, and models. While situational influences is how the health behavior is perceived to fit into a person's life. That is, a person's individual preferences or options, demand, characteristics, or the nature towards a behavior. While the third area is the behavioral outcome health promoting behavior, which is the behavioral outcome which makes it the endpoint in the health promotion model. There is a commitment to plan of action where it intends to carry out health behavior and willing to identify ways to do so. It is the concept where the intention and identification of a planned strategy that leads to implementation of health behavior, and a person is identifying or coming to a point to take some strategies or the plan of action. Next is immediate competing demand and preferences. So it is the other wants or needs that might interrupt the behavior just prior to starting. So here, you can see there are two terms that is competing demands and competing preferences. Competing demands are those alternative behavior over which individuals have low control because there are environmental contingencies such as work or family or care responsibilities. While competing preferences is our alternative behavior are which individual exerts relatively high control. And lastly, the health promoting behavior, which is the endpoint or action outcome directed toward attaining a positive health outcome such as optimal well-being, personal fulfillment, and productive living. So this is how the client is doing every day. If he or she is already doing exercise or taking dietary eating, and with the help of this behavior is directed attaining an optimal well-being, personal fulfillment, and productive living without any symptoms. So now that we already know the health promotion model of Nola Pender, so we have here a quote from Nola Pender stating that I believe that the future will be very bright and productive for nurses who direct their careers toward understanding disease prevention and health promotion process.